Altered Physiology, Mechanisms of Disease 1, Week 11, Episode 6, Alterations in the Male Reproductive System. In this particular episode, we will continue on in our lectures to explore some of the common disorders of structures such as the urethra, penis, and epididymis. So with that being said, we will get started. This first slide characterizes two disorders of the urethra. Urethritis, which is an inflammation of the urethra, and that is usually but not always caused by a sexually transmitted infection. The pathogenesis of this disorder is inflammation, and you can remember this more simply by the fact that it ends in itis. As that suffix is essentially meaning inflammation. However, there are also non-sexual origins that can be caused by urological procedures, the insertion of foreign objects, anatomical abnormalities, or trauma. Another disorder of the urethra is urethral strictures, and that is when an individual experiences scarring within the urethra, and this can be second to trauma or an untreated or very severe urethral infection. Notably, it can also result in kidney failure if it is severe and prolonged. Once again, if we think about the connection between the urethra and the kidney, it is responsible for producing urine, which then travels through the ureters to the urinary bladder before being passed through the urethra to the external environment. And therefore, if there is a narrowing of this structure, you can understand why there can be damage to the urinary system. Manifestations clinically of a urethral stricture include bladder outlet obstruction, as I've mentioned, changes in urinary frequency and hesitancy, a diminished force and caliber of the urinary stream, or the presence of dribbling after voiding, or more simply, after the main urine stream. Next, we'll look at disorders of the penis. Once again, carcinoma of the penis is actually quite rare in Canada. Penile carcinoma tends to involve the glands, and it is most commonly caused by squamous cell carcinoma. It can be treated if it is caught early. However, it may be the site of metastatic spread of solid tumors that originate in the urinary bladder, prostate, rectum, or kidney. It is primarily managed with surgery. Now, we'll turn our attention to looking at disorders of the testes. And one example would be testicular cancer. As you know, in normal anatomy and physiology, the testicles are responsible for the production of sperm and the male sex hormones, primarily testosterone. The two main types of cells in the testicles that perform these functions are the germ cells and the stromal cells. It is testosterone that helps the germ cells to make sperm. Testosterone also helps the reproductive organs develop and function. It contributes in normal anatomy and physiology to sex drive, the development of the genitals, and secondary sex characteristics. When we're talking specifically about testicular cancer, it is actually the most common type of cancer among young males. Risk factors can include high levels of testosterone, a genetic predisposition, trauma, or infection. Another risk factor is actually cryptorchidism, and that is where the testes do not descend properly during development. Nonetheless, while it is the most common cancer among young men, it is actually highly treatable. As I've mentioned, it can be caused by one of two types of cells in the testicles, the stromal cells or the germ cells. It is usually caused by germ cell tumors. Clinically, it manifests as a testicular enlargement that is painless. However, unfortunately, it is often misdiagnosed. Treatment for testicular cancer can include surgery, chemotherapy, and radiation. Next, let's look at epididymitis. Once again, it ends in itis, and therefore it indicates that it involves inflammation of this region. So inflammation within the epididymis is usually second to a sexually transmitted disease. Gonorrhea, chlamydia are examples. It typically manifests as pain within the scrotal or inguinal region. And notably, the sexually transmitted microorganisms or pathogens tend to ascend through the vas deferens from an already infected urethra or bladder. Individuals can also have chemical epididymis, which is the reflux of sterile urine into the ejaculatory ducts. And that concludes this episode.